My name is Nobuyuki Asai.
And I'm Harumi Endo from Soka Gakkai International.
Today, we'd like to speak about faith actors' role and function as a social safety net in local communities during the COVID-19 pandemic, because we think this role and function can enhance resilience and promote preparedness in the DRR context. In the first half, we'd like to showcase our own experience during the pandemic, and in the latter half, present an outcome of an academic research and learning process, also considering these within the DRR framework. It is often said that the people impacted the most by the pandemic are those in vulnerable situations, such as older persons, persons with disabilities, women, children, etc. Social distancing as a preventative measure to protect ourselves and others has intensified isolation of those in need. Japan is no exception, and the existing challenges faced by those in vulnerable situations became more apparent. During the pandemic, many social services stopped, and virtual communication tools were substituted for in-person interactions. While development of virtual tools has benefited many, older persons and persons with disabilities, especially those who do not have access to the internet and mobile devices, have faced a greater risk of isolation. Older persons make up 1/3 of the total population in Japan, and 20% of them are living alone. Among those who are older than 70, only around 40% use electronic devices like smartphones and tablets. This suggests that more than half of over 70s in Japan are not included in online communication. Also, for those who live alone and do not use internet, the isolation risk has been greater during the pandemic. This is a serious concern when thinking of DRR as well.
Moreover, the long-lasting social and economic crisis has generated a sense of hopelessness. During a state of emergency in Japan, many young people began to feel lethargic and alone, and some felt unworthy and lost sight of the purpose of their lives. The pandemic caused an increase in the suicide rate of young people and women in Japan in 2020, and the number is still high in 2021. There were various factors behind this increase, but such prevalence of hopelessness would definitely hinder the achievement of building back better in the recovery phase following the pandemic. Japan has gone through similar difficulties brought about by several disasters over the past decade, but it is still a big challenge. In a society where these issues are evident yet not addressed sufficiently, faith actors and faith-based organizations, FBOs, can function as a social safety net that identifies those in need and provides support. The Soka Gakkai in Japan and its members have played a role in connecting with individuals at the grassroots level in order to leave no one behind. The Soka Gakkai is a network of ordinary citizens who practice Mahayana Buddhism. Its members play a vital role in developing community resilience at a local level. In each district, which is comprised of about 30 to 60 households and is the basic unit of the organization, members hold activities like discussion meetings and home visits on a regular basis. And these have continued during this pandemic, observing social distancing rules as appropriate. Our local leaders are continuing to encourage members and provide care and support in any possible way. For example, they organize online or hybrid meetings, and for those who cannot join these meetings, they write letters and make phone calls. Also, leaders often teach older persons how to use online communication tools. I myself have often taught them and directly witnessed their joy felt through talking with their friends or members via these tools. In the video that we'll be showing now, several local leaders and members talk about the ways in which they remained connected during the pandemic.
一人でも多く置いてきぼりされない学会活動に参加してもらおうという努力をちょっと考えてやっております。本当にオンライン化されてね、便利な反面ついていけない人が本当にいらっしゃる中でね、工夫って大事だなっていうふうに感じて努力しております。
だからスマホを持ってる方はねいいんですけど、そうじゃない方がやっぱりだんだんこう置き去りになってしまうって、だからそういう方たちにどういうふうにね手を差し伸べていくかっていうことがね大事かなって思うんですね。だから時たまこう回って皆さんの声を聞くようにしてるんですね。
自分も外出ない代わりに皆さんももうお家にいるわけでしょ。そうするとさ、コンコンって来てくれる人はみんな学会の人しかいないしね。
糖尿があって弱視だったんだけど、だんだん目が今ね 0.05 しか見えなくなったもんね。皆さんもね、ご親戚が遠くだからね、なかなかね連絡も今取れてないから、私がたまにね。
These experiences became all the more helpful when the large-scale vaccination program was launched last year. Vaccination appointment has to be made by phone call or through online tools. Older persons tend to choose phone, but initially lines were limited and it was difficult to get through. More than half of the older persons are living alone or only with their spouse, so they couldn't get support from their family members. In some cities, the local municipal offices arranged a help desk for making appointments, and more than 100 people will be lining up for help. In light of this problematic situation, in some areas, youth members of our organization led a campaign to help older persons make an appointment. I myself helped more than 10 older persons together with other youth members. As far as I know, there was no other organization in Japan that voluntarily promoted such a campaign. Here is a short interview with a member who received help from youth members in the campaign.
電話しても聞こえないんですよね。皆さんほらマスクしてるし、ちょっと電話が下向いて喋ってったりすると全然聞こえなくて、わあもういいや、めんどくさいもうで何回あれしても聞こえないから、もうダメだと思ってたら、いやじゃあ青年部の人たちが今来てやってくれてるから、雨の中だけど行きましょうっていうことで来て、そうしたら目の前ですぐやってくださったのね。でびっくりして助かりました。本当に助かりましたよ。
The network we have developed through our daily activities and interactions also functions as a safety net in an emergency. In her study, a scholar Ahmet Fisker Nielsen describes the Soka Gakkai and faith-based organizations. The Soka Gakkai's organizational strength and its stronghold within the community mean that, along with other religious organizations, it is sometimes among the first to deliver emergency supplies and help people who, in the first few days, have to rely on themselves and neighborhood relations. She continues, rather than waiting for a centralized command, the initiative for action came swiftly from the local level, which continues to be the case today. This was confirmed again on March 16 this year when a big earthquake hit the Tohoku and Tokyo metropolitan area. Due to our close-knit local groups and engagement with local community groups on the ground, we are also often aware of the situation of other vulnerable people in the community. Now, we would like to show you a video of a youth leader who responded to the earthquake in his local area.
ちょうど今月16日に大きな地震が東北でありました。でその時にまず真っ先に私何したかというと、つながっているゼミ生に安否の確認の連絡をしてともにですね、普段からお世話している男子部青年部の創価学会のメンバーの後輩たちにですね、一人一人連絡したり電話したりしてこの安否状況を確認しました。でまたですね、誰から真っ先に連絡が来たかというと、地域で一緒に活動している創価学会の方々ですね。もういざという時にこの人々とのつながりの重要性っていうものを本当に心から感じました。なのでこういったつながりというのは、先ほどソーシャルキャピタルという言葉を紹介しましたけれども、財産なんだ、私たちが意識して守っていかなきゃいけないものなんだという意識をこれから持っていくということが大事かなというふうに思っております。
連絡していただいて、一人で住んでやっぱりね、不安も多少ありますので、でもまだ元気でおりますのであれですけども、年配の人なんかは連絡していただければありがたいんじゃないかなっていう、助かりました。
We also tackle the issue of misinformation. Taking the digital divide into consideration, the Soka Gakkai has continued to make efforts to disseminate correct information using multiple platforms. The Seikyo Shimbun, the Soka Gakkai's daily newspaper with a circulation of 5.5 million in Japan, has carried numerous articles on topics like preventative measures and COVID vaccination to spread information from trustworthy sources. Newspapers are a major source of information in Japan, particularly for older persons. And carrying articles with such information can prevent misinformation and misunderstanding. The articles are published both in print and online and can reach a wide audience, including those who do not have access to online tools. The Seikyo Shimbun also provides an audio service for anyone who is blind or with visual impairment. Newspapers are published by media companies, but I believe information provided by a religious organization's newspaper or magazine will have more impact on its readers as it is trusted more. In 2020, the Soka Gakkai Youth Division launched an online campaign called Stay Home Project, in which they spread correct information through social media. In September, they conducted an online awareness survey among about 20,000 youth in Japan in order to figure out young people's situation, including their sources of information.
Now, I'd like to move to a second point. Since last year, we joined the learning engagement process arranged by Joint Learning Initiative on Faith and Local Communities, or JLI, a network of academics and faith-based organizations. JLI was aware that many of the experiences and lessons from faith actors during the pandemic were not being documented. Given this situation, JLI partnered with 8 faith actors, including ourselves, to learn together what works and what remains to be done in terms of faith responses to COVID-19 to support better preparedness and improved partnerships in the future. I'd like to quote some excerpts from the report and relate them to DRR. The key points that are closely relevant to DRR are as follows: pre-existing and trusted partnerships, tackling misinformation, spiritual support from the mental health viewpoint, preventing marginalization. To quote, COVID-19 highlighted the need for pre-existing, trusted partnership at all levels. In the words of one interviewee, trust isn't something you can easily build during the crisis. Existing partnerships were often strengthened as support was seen as vital and opportunities emerged for strategic collaboration. Such partnerships are recommended by the Sendai framework as well. We would like to broaden partnership with more organizations on a daily basis for promoting DRR. To quote further, in order to counter misinformation, faith actors agreed that support for actors already trusted by local groups is required. As one interviewee pointed out, these communities don't accept a lot of outsiders, so we find a lot of local faith partners to be able to support us in that area. In order to enhance DRR preparedness, information and communication is one of the keys, and we believe faith actors can make a difference. The research also found that spiritual support calmed people and had been helpful for preventing spread of misinformation as well. We have felt the importance of this point following various natural disasters as well. Even the affected people can rise up and become protagonists of recovery in a community because they are receiving such support. To quote, there were significant concerns about further marginalization through digital inequality. Disabilities create a barrier for some, if not actively included. Many also noted a generational divide, with older members finding it hard to connect. Faith actors came up with ideas to increase digital accessibility, including setting up WhatsApp groups or creating hubs where several people could join online meetings together. As Harumi said, in Japan, we proactively taught some thousands of older members to use the internet or Zoom. I believe many FBOs and local faith actors are able to reach such vulnerable people and help prevent marginalization in the DRR context. In addition, JLI's report also highlights some challenges. There is a need to focus on capacity development of FBO staff and local faith leaders so they have the confidence to act. Another need is to find ways to listen deeply to marginalized voices through supporting local advocacy fora. For example, building closer relationships with a wider range of local faith actors so they can speak out. Now, we are determined to deepen our own understanding and share these learnings with other stakeholders in order to create better and broader partnerships. Thank you so much.